Human blood and other body fluids may include pathogenic germ, known as a blood-borne pathogen. Bacteria known as a blood-borne pathogen can be contracted by coming into touch with the blood or other OPIM like saliva, tissue, or bodily fluids. Scaling and root planning, restorative procedures, and surgical procedures in dentistry are commonly dental operations that can spread blood-borne pathogen, posing a serious risk to dental healthcare professionals and patients. During dental operation, saliva, blood, or other bodily fluids come in contact with patient, exposing them to blood-borne diseases.
These are the common oral and respiratory diseases in the dental office. Hepatitis B virus or HBV is a serious viral infection that primarily affects the liver. It can cause both acute and chronic liver disease and is a major cause of liver cancer and cirrhosis. Symptoms can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, joint pain, and jaundice. The severity of HBV infection can vary wildly from mild to severe and can be influenced by factors such as age, immune status, and coexisting medical conditions. Treatment: antiviral medications are available to treat chronic HBV infection and can help reduce liver damage, prevent cirrhosis and liver cancer, and also improve overall survival. The choice of antiviral medication depends on the factors such as the severity of liver disease, the presence of other mechanical conditions, and the patient's overall health. Hepatitis B vaccine is available and is recommended for all infants, children, and adults who have not been vaccinated and are at risk of HBV infection. It is highly effective in preventing HBV infection.
Hepatitis C virus or the HCV virus can potentially lead to liver inflammation. It can survive for up to 4 days outside the body and is spread by contact with blood and other bodily fluids. The hepatitis C virus is a small envelope positive sense single-stranded RNA virus of the family Flaviviridae. The hepatitis C virus is the cause of hepatitis C and some cancers such as liver cancer and lymphomas in humans. Oral manifestation of HCV is lichen planus. It is an immunologically mediated skin and mucous membrane disease which has been described in patients with hepatitis C virus-related liver disease with variable frequency in several studies to date.
HIV or human immunodeficiency virus is a virus that attacks the immune system, leading to AIDS. HIV transmission can only occur when there is a direct and prolonged exposure to body fluids, semen, vaginal fluid, blood, or mother-to-child through breastfeeding. In healthcare settings, potential sources of viral contamination include cutaneous, mucous membrane, and percutaneous contact to contaminated body fluids. Oral manifestations are early and important clinical indicators of HIV infection. Oral lesions are seen in 70 to 90% of HIV-positive individuals during the various stages of the disease. These lesions include obtuse ulcer, hairy leukoplakia, Kaposi sarcoma, linear gingival erythema, oral candidiasis, and necrotizing ulcerative periodontitis. The two primary HIV subtypes, HIV-1 and HIV-2, are comparable in many aspects including their fundamental gene structure, means of transmission, intracellular replication pathways, and clinical outcomes. Both results in AIDS. Dental professionals have a lower risk of HIV infection compared to other healthcare providers. Few studies stated that only two types of procedures, the root canal therapy and extractions, have been investigated in relation to HIV infection in the dental office.
Syphilis. Syphilis is a highly contagious disease that's mostly spread through sexual activity, including oral and anal sex. Syphilis is caused by the bacteria Treponema pallidum. When untreated, syphilis lasts many years and goes through different stages. These are the symptoms of syphilis. First, primary syphilis. People with primary syphilis get one or more sores called chancres. They're usually small, painless ulcers. They happen in your genitals, in your anus or rectum, or in or around your mouth between 10 and 90 days, 3 weeks on average after you're exposed to the disease. Even if you don't treat them, they heal without a scar within 6 weeks, but treatment will keep your disease from moving to the next stage. The next one is secondary syphilis. People with secondary syphilis usually get a rosy copper penny rash on the palms of their hands and soles of their feet. They may also have different rashes on other parts of their body. These may look like rashes caused by other diseases. People may have moist, wart-like lesions in their groin, white patches on the inside of their mouth, swollen lymph glands, fever, hair loss, and weight loss. As with primary syphilis, symptoms of the secondary syphilis will get better without treatment. The last one is the tertiary syphilis. If the infection isn't treated, it may move on to stage marked by severe problems with your heart, brain, and nerves. You could become paralyzed, blind, or deaf, or get dementia or impotence. It can even be deadly. It most often contains a mass of dead and swollen fiber-like tissue, and it's called gamma. These are the oral manifestations of syphilis: primary, secondary, and tertiary. Medications for syphilis. When diagnosed and treated in its early stages, syphilis is easy to cure. The preferred treatment at all stages is penicillin, an antibiotic medication that can kill the organism that caused syphilis. If you're allergic to penicillin, your doctor may suggest another antibiotic or recommend penicillin desensitization.
Herpes simplex virus is a virus that can cause oral or genital herpes. It is transmitted through contact with bodily fluids, including saliva. The nerves in the area are invaded by HSV when it touches the skin surrounding the mouth. After then, it stays there silently for 2 to 20 days. The first outbreak could happen after that. Blistering on the lips, tongue, and inside of the mouth may result from this epidemic. A flu-like condition that affects your entire body is also possible. A fever, general aches, and pains and swollen lymph nodes may accompany it. This is the pathogenesis and clinical presentation of herpes simplex viruses. The virus enters through mucosal surfaces and then spreads via nerve endings to sensory ganglia. Some viruses then establish latency in the sensory neurons. The incubation period is usually 2 days to 2 weeks.
Dental healthcare workers are more likely to be exposed to bloodborne pathogens. These are other examples of bloodborne pathogens that may be encountered in dentistry: methicillin-resistant Staphylococcus aureus, or MRSA, tuberculosis or TB, West Nile virus, Ebola virus, Creutzfeldt-Jakob disease, or CJD.
Dental healthcare providers must be knowledgeable about infection control and continually be aware of likelihood exposure to these and other bloodborne infection in order to take the required steps of health transmission. To stop the spread of infectious illnesses, ensure the health of the patient, dental healthcare provider, and the general public. Infection control in dental clinics is very crucial. This may entail the appropriate infection control techniques using PPEs such as gloves and masks. To stop the transmission of infectious illnesses and uphold the high standard of patient care, dental clinics must adopt and adhere to correct infection control policies.